We have tried to understand what is old age syndrome. Old age syndrome, there is decreased body mass, increased body fat, and reduced muscle mass, reduction in plasma protein, that is albumin, decline in cerebral function, decreased motor as well as the visual and the auditory functions. Because of the degeneration of all the neurons, actually, they're all there. We can see the physiological changes which are very much oftenly seen in the old age, that is in geriatric, and together it is called to be as old age syndrome. Okay, let us now move to the age related physiological changes in the human body. Coming to the drug absorption, the peristaltic movement is reduced to a great extent, so absorption is decreased here. The peristaltic movement is responsible for increasing absorption. If there is a good peristaltic activity, whether it is peristaltic movement of the intestine, peristaltic movement of the stomach, whatever, the peristaltic movement is reduced because of physiological changes which is happening due to old age. There is decreased acid secretions in the stomach, thereby there is a decreased renal blood flow to the GIT with an increased pH. All these factors where what happens now, the drug absorption is delayed now. Now coming to the distribution pattern of the drug therapy. Drug distribution in the blood or plasma is directly proportional to the amount of protein, that is albumin, which is present in the body. So albumin content is reduced to a great extent. Decreased albumin content is seen in geriatric population. That results in increased free drug concentration in the body. So because of decreased albumin, the normal dose becomes the toxic dose. We all know that, see, the general mechanism which is of drug distribution, the drug has to bind to the plasma. The drug has to bind to the particular plasma, that is albumin. When plasma protein binding is reduced, the drug stays, the free drug is available in the body, which becomes the toxic dose. The toxicity is generally seen in the geriatric population because of free drug available where there is decreased content of plasma protein. Now, if there is reduction in water content, there will be reduction in volume of distribution. There is reduction in water content as well as volume of distribution is decreased, and with the increase in fat content, the volume of distribution increases now. So what happens if you take the example of diazepam, which is a lipophilic drug that induces sleep, is given in more doses as there will be an increased volume of distribution, in some cases only in certain categories of drugs like diazepam. Now straight away we'll see the metabolism process which happens in the geriatric population. The drug metabolism takes place with the help of the hepatic microsomal as well as non-microsomal enzymes. Everywhere when there is a role played by liver, there is nothing but hepatic microsomal as well as non-microsomal enzymes. In elderly patients, there will be decreased in metabolic process due to decrease in enzyme concentration. That is, I told you, the drug metabolizing enzymes, the main drug metabolizing enzymes are like cytochrome P450 and NADPH enzymes. These are the enzymes which play a great role in drug metabolism process. When the enzyme levels are reduced, the concentration of free drug increases in the body. So thereby it causes toxicity. Now the example here, the alprazolam and the barbiturates shows prolonged effect in geriatric patients because of this effect. Lastly, we will move on to the elimination part of this chapter. Drugs are mainly eliminated through kidneys. We all know that in geriatric population, the GFR rate is reduced because there is a decreased renal blood flow. So Thereby there is a decreased renal blood flow, GFR is reduced, decreased tubular secretion, decreased in creatinine clearance, and increased drug concentration in the plasma. Example, increased drug concentrations of cephalosporins and sulfonamides are seen in body due to decreased blood supply to the kidneys. So when the kidneys, when they are low perfused, when they are getting inadequate supply of blood to the kidneys, there an enzyme is secreted, which is nothing but a substance is secreted, which is renin, which is a compensatory mechanism for hypertension, that is renin angiotensinogen aldosterone system. Now let us move to the guidelines which are there in geriatric population. The range of drugs, that is number of drugs prescribed, are to be limited despite of the presence of comorbidities in elderly patients. The comorbidities are very high in geriatric population. Geriatric population may be having 2 or 3 disorders like hypertension, which is associated with diabetes mellitus, or some other conditions like dyslipidemia. Reduced doses, lowest dose are to be prescribed as the pharmacokinetic parameters of the geriatrics are altered. Choose the right dosage form, preferably the oral route is the best one. Medication history information, because to avoid interaction of the drugs. Treat the cause rather than treating the symptoms of the disease. So understand the pathophysiological mechanism behind the patient. Here, an elderly gout patient presenting pain prescribed with analgesics, which is a symptomatic treatment, has to be treated for hyperuricemia. Here, what he says that treat the cause rather than the symptom. See, if the patient is having the gout problem, now you're treating with analgesics, which is maybe because he's having a problem of pain, but the problem of the pain is not the thing, the problem of gout is the main problem here. The pathophysiology behind gout has to be treated now, okay, which is nothing but hyperuricemia, which is nothing but increased level. Hyperuricemia means abnormally increased amount of the uric acids in the blood. Consider concomitant illness in a patient presenting hypertension and hyperuricemia. Diuretics class of drugs are contraindicated. So whenever the patient is presenting both the condition like the hyperuricemia and hypertension, the diuretics class of the drugs are contraindicated in such conditions. Dose titration depending upon the physiological factors like blood flow, hepatic function, renal function, as well as the liver function. Renal function, especially the GFR rate, the dose titration need to be done. Under prescribing, in case of antibiotics, ensure the completion of entire regimen. So the patient should not be left with any drug without completing the course. Entire regimen has to be taken without deviating the principles of prescription. Simplify the dosage regimen. The dosage regimen should not be complex. It should be made very easy so that patient compliance is increased and improvement in the quality of life care of the patient is increased. That completes the geriatric guidelines now. In the next part, we'll be seeing the pregnancy and breastfeeding guidelines. Thank you.